Tonight at 11, it's a hidden battle. Many in our area are fighting a battle against their own insurance companies.
Right, so when life-saving care leads to life-altering bills, who is standing up for patients? Chief investigative reporter Eric Flack reveals how AI may be behind some questionable decisions by insurance companies.
You want a treat? Settle down.
It was a matter of life and death for Amanda Boley when she suffered cardiac arrest last October. Emergency responders made a critical decision. She needed care at a level 1 trauma center, but the closest one was 44 miles away. With no time to spare, paramedics airlifted Boley by helicopter. She came to 2 days later.
So I woke up. I had IVs everywhere, out my neck, my arms. I was intubated, and I remember looking, and I knew immediately this is a hospital.
6 weeks later, still recovering from her ordeal, Boley received a shocking bill, nearly $65,000. Her insurance company, Anthem, had denied coverage entirely for that life-saving medical helicopter transport. The reason? Anthem said Amanda needed pre-authorization for the flight.
That night I was dead, and then I was unconscious. I don't know how I'm supposed to get pre-approval.
This woman was in cardiac arrest. What sort of pre-approval are we even talking about here?
I can't imagine what the pre-approval would be in an emergency situation. It doesn't even make sense.
Patricia Kelmar is the Senior Director of Healthcare Campaigns for the Public Interest Research Group, or PIRG, the D.C.-based nonprofit that fights for consumers against what they see as a broken medical billing system. Kelmar says Boley's case isn't isolated, although data is limited because insurance companies are not required to disclose information on coverage denials. But Kelmar says more and more artificial intelligence may be to blame.
We know right now that insurance companies are using AI to deny claims. Now, of course, we all want to use AI when it's more efficient and it saves money. But at some point, these are individuals who have medical records, medical histories that may not fit into an AI model.
Boley appealed her denial twice. Both times, Anthem doubled down, stating air ambulance services are subject to medical necessity reviews and will only be covered when approved in advance.
I cried. I felt sick because how am I going to pay that?
So WUSA's sister station in Indianapolis fought that $65,000 bill for Boley, and Anthem suddenly reversed course, admitting they made a mistake and covering the bill in full.
It's okay.
Amanda Boley is relieved, but not reassured. It won't happen to someone else.
When people have a medical crisis happen, they should be allowed to heal. They should not have to worry about struggling to make ends meet so that their insurance company can profit.
PIRG says up to 75% of appeals result in overturned insurance denials if you know how to work the system. First, request and keep itemized medical bills. Second, go to your HR department because sometimes the company has more influence than the individual patient. And third, report any unfair medical billing practices to state and local regulators. Eric Flack, WUSA 9.
If this has happened to you, reach out to Eric Flack here at the station. Public Interest Research Group also offers guidance on how you can report your own insurance denial cases. We put a link on our website. Just look for this story on WUSA9.com.